Dear friends and colleagues, it's 14th of July 2025 and I'm talking to you, I'm recording this video for you from the beautiful city of Warsaw in Poland. Thank you for watching this video. In this video, more specifically, I'd like to talk about double filtration plasmapheresis and compare it to therapeutic plasma exchange or TPE and the amazing advantages that this new subtype of plasmapheresis has over the TPE. Basically, if I'd like to start with the fact that to us, the main point, I'd start about the access. So in double filtration plasmapheresis, we don't really need the jugular or central vein. We don't need the access of the jugular vein. So that is a very, very, very big plus. Because even if you do it by the best hands of our anesthesiologists, still there might be some complications. Depending on the patient, if the patient doesn't have good vein or the patient had already gone through chemotherapy or steroid therapy. So this is a big plus. As you can see, now I'm sitting as a patient. We just need to use the peripheral vein underarm easily, and this blood flow is totally and fully enough for us. And as you can see in this amazing ApherSmart Plus made by Medica S.p.A. in Italy, we don't use the centrifuge to separate the plasma from the red blood cells. Basically, we use the plasma filter to do that. This is the big plus. About the other advantages that DFPP offers is that we don't need plasma donor, we don't need albumin replacement, because here we filter the plasma, as you can see in the second filter, and the patient maximum loses around 150 to 200 milliliters of highly concentrated pathogenic plasma that is full of toxins, full of autoantibodies and harmful substances, pathogenic inflammatory markers, heavy metals, the residue of the vaccines, the spike protein of coronavirus or even from the vaccine, LDL, triglyceride. So that is a perfect option. So if we don't lose plasma, if we don't have to substitute a huge volume of the plasma, we're not going to have the electrolyte, the complications like electrolyte imbalance. We're not going to have anaphylaxis. And we're not going to have possibly infection. So this is basically, there's no infection because we're not taking anything from any other person or from an outer source. It's just the person's plasma that is filtered and it gets back to the body. Another super advantage of this technology, especially this amazing machine, is that there is absolutely zero surface of contact. There is no contact between the person's blood, plasma, between the machine. And as you can see, the blood and plasma and everything goes through and in contact with sterile disposable sets, tubing sets and filters that's been sterilized in a very, very highly strict facilities by gamma rays or by ethylene oxide or maybe by both of them. So basically the risk of infection is zero, and if it's not zero, it's very close to zero. This is the second advantage. The third super advantage is that basically, apart from the fact that it makes the patient feel immediately better, for example, for me as a patient that I got all different kinds of autoantibodies, including the myasthenia gravis antibodies and lupus anticoagulants, and the list goes on and on and on with GP210. So, as you may know, the diagnosis of autoimmune diseases, it's hell of the way. It takes a very long time. By the time that the targeted autoantibody reaches the tangible, detectable serum level, that together with the symptoms, finally the rheumatologist could come to point that, yeah, this person, this is the diagnosis. But here, as you can see in this bag down there, because we have higher concentration, we can targetedly, easily give this plasma to the lab, and we say that please look for this autoantibody, for example, for us. And that would help a lot. It's a miracle, and miraculously basically helps the specialist to come to a point finally. So it's not only a treatment, it's not only a very, very quick relief and helps with the symptoms, especially, for example, we have a patient with myasthenia gravis crisis, but also it offers a very, very amazing method for diagnosis. During the procedure, as you can see, for example, the heart pump that we have 80 milliliter per minute. Per minute, 80 milliliter of blood leaves my body, and at the same time, in venous line, I get 80 milliliters of blood back to my body. So these are amazing advantages of DFPP or Double Filtration Plasmapheresis compared to the Therapeutic plasma exchange. That it makes this easy and accessible, that we could do it even in a clinic. If it's done by a medical professional, it's absolutely safe. You don't need hospital, and this is actually our goal, and the goal of our company, to make plasmapheresis accessible for everyone. And instead of having it as a last line of treatment compared to corticosteroids like prednisone or methylprednisolone, we can bring it down there, and somehow we can use the combination of them. So it's really perfect. It's the future, and it's the new technology that helps a lot, and especially me as the patient. So thank you so much for watching this video. In case you have any questions, in case maybe I forgot to add any more points, please write it down in the comments. I'd be so grateful to you to comment your feedbacks. And if I want to add as a last point, sorry, it just slipped my mind, is that the second filter that filters the plasma after it warmed up to around 39 degrees, we have 3 options, and we can targetedly, based on the molecular weight of the substance that we are basically targeting, we have large fraction smart, medium size, and small filter. For example, we use the large mostly to take out the LDL, triglyceride, and many other substances out of the plasma. Generally, it's very, very well tolerated for any patients, and I could say that during all these years that we've been involved in that, almost we had zero complications. Thank you so much again. See you again with a new video. That then we're gonna discuss the difference between selective apheresis and double filtration plasmapheresis for some specific diseases. Thank you so much. Hope to see you soon again in the next video. Thank you.